Hi everybody, welcome to week 7. We are down to our last 2 weeks together. My goodness. I'm really looking forward to reading your week 6 papers. I think those will be interesting, looking at those spiritual assessment tools and such. All right, so our objectives for this week. Evaluate the effectiveness of the interaction of the interdisciplinary team. Assess how patient safety and quality affect nursing care. Analyze how safety and quality within the interdisciplinary team impacts total health assessment. So we're going to be talking a lot about team stuff. What does it have to do with quality, patient safety, all that kind of good stuff. This week's readings I thought were really interesting. I especially liked the article about the Schwartz Center educational rounds to enhance the interdisciplinary team members' communication skills during difficult conversations. Part of this strategy involved bringing in patients who had experienced some of these difficult circumstances firsthand, and I think that's so impactful. I've used a somewhat similar strategy in class in a little different way. I've shown videos of patients discussing what it's like to have a certain disease or condition, and that has really helped my students to understand a little more about our patients being actual people and not just a compilation of organ systems, right? Okay. So, more and more practice settings, I think, are trying to enhance interdisciplinary collaboration. You know, we've tried to do that in the hospital quite a while. So, an example of recent change, somewhat recent, includes primary care practice clinics incorporating the role of, it might be called a nurse navigator or a medical home nurse coordinator. The provider, during a really short, usually really short office visit, can only really do so much. But when a provider and a nurse collaborate with the patient to create a realistic plan with adequate resources, then great outcomes can really, I think, be achieved. So I'm kind of excited about that trend continuing forward. All right, let's look at our discussion questions. So, the first is about explaining the concept of an interdisciplinary team. And too often, different disciplines work side by side when treating patients, but don't truly function together as a team. So we're going to be talking about that. I've got some class questions that I'm going to be adding to kind of spark our discussion. And so we're going to talk more in depth about interdisciplinary teams. Our second discussion question deals with communication, collaboration, and patient safety. And it can be tricky at times when we've got to collaborate with other people, especially if there's maybe a perceived power differential between the individuals. So part of this does tie into creating a culture of patient safety within an organization, and we're going to be talking more about that this week. All right. A brief word about the final CLC assignment. You don't have an assignment in week 7, I believe, but you've got that final one in week 8. So you'll be using and analyzing a risk assessment tool. Common ones that we think about are like the Braden scale or a fall risk assessment tool, something like that. Remember, in the description of the assignment, you're given a list of specific risk assessment areas to choose from. So it's got to be a risk assessment tool from one of those areas. So the 3 of you need to come together to choose an area and then a tool. And this tool needs to be applied to 10 individuals. Okay, just like if you were doing a Braden on 10 patients. You're going to have 10 individuals, preferably not patients, just people that you know, kind of like in the past assignments. So one person can administer the tool, use the tool with 10 people off the bat, or you can each divide it up and you each have 3 or 4. Okay, that part you can do whatever way you want. But all of you have to play a role in writing the content for the PowerPoint slides. I need to see that everybody was involved in developing that material. And remember, like kind of in the last week's assignment, I think, you're also looking at reliability and validity of your risk assessment tool. So it does have to have some research to back it up, so you can look at that. In the paper, you'll need to analyze several things, including the results obtained. So like, does the assessment of risk that you came up with after using your tool seem appropriate to the individual that was screened? Does this seem like, yeah, I've got that person's risk right? So you will actually be briefly presenting information about your participants and those results. So yeah, so they will be part of the presentation. So then I just wanted to make sure that everybody's kind of all on the same page with at least the first step of selecting the tool from the list of areas, getting the 10 participants, collecting your data. And then next week I'll go into some more specifics about the actual slide presentation itself. But please know that if you have any questions before then, you can certainly always ask me if you guys somehow are working ahead and find time to do that. Anyway, so I think that's about it for this week, and I'll see you in the main forum.